At Starbright Dental, we operate on a single, uncompromising standard, delivering clinical excellence and permanent solutions for our clients' long-term oral health. Periodontal disease rarely starts with pain. Instead, clients notice small shifts, a sudden metallic taste, a streak of pink in the sink after brushing, or a vague sensation that their teeth have moved slightly when biting down. These visible signals indicate that an active bacterial infection is already established well below the gum line. In a healthy state, the gum forms a tight collar around the root. This creates a shallow groove, called a sulcus, that is typically 1 to 3 millimeters deep. At this depth, saliva and daily brushing can successfully manage the bacterial population. When the bacterial balance breaks down, plaque begins to colonize the groove. If it isn't removed daily, it hardens into calculus, a rough, porous surface that is impossible to clean with a toothbrush, and provides a permanent anchor for bacteria to thrive. As bacteria multiply, the body responds with chronic inflammation. To keep the infection at a distance, the immune system begins dissolving the bone around the teeth. As the bone retreats, the gum pulls away, and that shallow groove deepens into a true periodontal pocket. Once the bone has shrunk, it does not grow back on its own. Every treatment decision from this point forward must prioritize protecting the structural foundation that remains. Many clients respond to these signs by brushing harder, switching toothpastes, or flossing more. The bleeding may stop temporarily, but it inevitably returns. This occurs because home care has reached a physical limit. A toothbrush or floss cannot reach the bottom of a pocket that is 4 millimeters or deeper. At this depth, the pathology changes. Deeper pockets host aggressive, oxygen-hating bacteria that feed on the body's own inflammation. The infection becomes a self-sustaining cycle that home care cannot break. This creates a frustrating cycle. Clients return for professional cleanings every 3 months, only to be told that their pocket depths have not improved. If your numbers remain flat or grow after proper cleanings, it is not a failure of your personal hygiene effort. Persistent bleeding is biological evidence that the infection is active. Doing more surface-level cleaning will not change the result once the underlying architecture of the pocket has permanently deepened. Scaling and root cleaning, what most call a deep cleaning, is an effective procedure for early to moderate gum disease. It removes deposits from the root surface, allowing the gums to begin healing. However, the procedure has a mechanical ceiling. Standard dental instruments predictably clean pockets up to 5 millimeters deep. Beyond that point, the clinician works blind, by feel. Some talculus is removed, but bacterial deposits at the base of a deep pocket are frequently missed. This leads to a deceptive recovery. The symptoms improve and inflammation calms down because the top of the pocket is cleaner, but the residual bacteria at the base of the pocket begin to repopulate. Within months, the biofilm reorganizes and the infection reactivates. This results in continuous costs for maintenance, while the bone continues to quietly degrade. Advanced periodontitis is a geometry problem. Standard mechanical tools cannot physically reach the source of the disease. To address disease that has bypassed the 5 millimeter limit, we utilize LANAP, the laser-assisted new attachment procedure. LANAP utilizes selective wavelength physics. We introduce a thin laser fiber directly into the deep pocket, emitting a specific frequency of light. This wavelength is absorbed exclusively by dark bacterial pigment and diseased tissue. The laser vaporizes the infection and the diseased lining of the pocket, while leaving the rest of the mouth untouched. The light passes harmlessly through healthy gum tissue, the tooth root, and the bone. This precision contrasts with traditional flap surgery, which requires cutting the gum away from the tooth to see the root, often removing a meaningful amount of soft tissue in the process. With the soft tissue infection neutralized by the laser, clinicians can then use ultrasonic instruments to easily clear the deposits from the root surface. By replacing physical force with light-based selectivity, LANAP neutralizes the deep infection without inflicting trauma on an already compromised tooth. Destroying the bacteria is the first phase. The clinician then passes the laser a second time, shifting the goal from infection control to cellular repair. The second laser pass interacts with blood to form a stable fibrin clot, sealing the pocket. This biological scaffold provides a stable environment for native cells to reform the connection. Over months of healing, the body rebuilds ligament and new bone. While traditional surgery focuses on removing the infection, it does not actively create the required conditions for this type of tissue regrowth. Biological recovery requires an isolated, blood-rich matrix that allows the body to reconstruct its lost foundation. LANAP is a definitive, advanced periodontal procedure. It is used when disease has progressed past the point that standard cleaning can resolve and is inappropriate for simple gingivitis. 3 specific client profiles benefit most from this protocol. First, clients with advanced periodontitis, characterized by pockets of 6 millimeters or deeper with measurable bone loss. Second, clients with unresolving disease who have had multiple rounds of deep cleanings that failed to stop the bleeding. Third, it is a critical option for clients who have been told their teeth are unsavable and must be extracted. If you are facing extractions, understand a key distinction in periodontal care. There is a meaningful difference between the diagnosis, "this tooth cannot be saved," and the reality of, "I cannot save this tooth with the procedures I offer." Before agreeing to permanent tooth loss, pause. Seek a comprehensive periodontal second opinion to find out if the LANAP protocol could save your natural teeth. Precision technology exists to solve the root problem, so you do not have to accept a lifetime of unresolving maintenance or premature tooth loss. Contact the team at Starbright Dental today to schedule your evaluation and begin your path